For my field trip, I attended the Home Care and Assisted Living Advisory Council on April 11th, 2016. The Home Care and Assisted Living Advisory Council was developed by the Minnesota Legislature as a way to solicit advice and input from the stakeholders in policy changes and development related to home care and assisted living, hence the name of the council. The stakeholders represented on the council itself were home care nurses, home care and assisted living managers, and the general public. However, the meeting was open to the public, so a lot of other stakeholders came as well, including home care employees such as nurses, PT, OT, social workers, bath aides, PCAs, physicians, kind of everybody that you find in medicine, as well as a variety of other legislatures. There were representatives from the Minnesota Department of Health, the Minnesota Department of Public Safety, the Minnesota Department of Human Services. The one stakeholder that wasn't present at the meeting were patients in home care and residents of assisted living. It would be hard, I would think, for these people, that particular population, to make it to a meeting, but there wasn't a really way for them to get into it. There wasn't any Skype ability or anything like that. So these people were, unfortunately, probably one of the larger stakeholders, and they weren't represented at the meeting. There were several policies discussed at the council meeting. One of them was House File 2694, which allows certain exempt services provided by licensed staff. What that means in real people speak is that, for example, if you're a resident at an assisted living and you're receiving services from the assisted living, but you live with your spouse and they're not receiving services, if a nurse, for example, comes in to give you your medications and your spouse has cut their finger, the nurse would be able to assess that injury, maybe bandage it as needed, without actually having to provide an entire assisted living intake form with the thorough health exam and the financial burden that goes along with that. Another policy that was discussed was an allowance to issue immediate temporary licensure to home health agencies in rural areas. The way this one came about was there was an agency up in northern Minnesota that was shut down by the state, and they had another agency that was ready to take these patients on, but because of the gap in being able to, in applying for a license and being provided that license, there was a significant gap so that the patients weren't getting cared for. So what this allows is for when there's an agency that gets shut down, they can issue an immediate temporary license to, say, another staff person that wants to step into this position without having to go through that waiting period. Another policy was discussed was an addendum to the current law to allow home care providers to dispense medical marijuana. Currently, only hospice and palliative care physicians are able to dispense medical marijuana in Minnesota. So this is actually going to be passed in this next legislative session, most likely, to allow home care providers to dispense the medication as well. Other discussions that came up during the meeting. There was a review of the nursing home and assisted living surveys that have been done in the last 6 months. There was also a discussion on the nursing shortage in Minnesota. Why are we so short of nurses when we're actually graduating a lot of people from nursing programs? There's about 2,000 open jobs for nurses in Minnesota right now, and we're graduating 3,900 graduates from accredited programs in Minnesota. So there's a gap in here, and we're not quite sure why. There was also a discussion on the budget bill to allow for education to seniors, on how to avoid financial exploitation. There was discussion on the use of technology in home care, not only computers that we're using, but telehealth resources as well. And then there was a brief discussion on the open positions in the council. Program manager position is open, home care licensee, and a public member from outside the metro area. They have a public member from locally from inside the metro area, but not somebody from the rural areas. The role of nurses in home care agencies and assisted livings is huge. We're the primary employees of home care agencies and assisted livings. We're the ones providing the care. We're also managing and owning these companies, as well as the primary employees of the overseeing boards, the people who are coming in and critiquing and going over all the details. Those people are usually nurses. The one thing that we're not is the people developing the policies. And this kind of goes back to our OIM report in the future of nursing, that while nurses are very much the largest body of employees in the medical system, we're not in a lot of leadership positions, and that's reflected in Minnesota as well. So this kind of flows into the impact that this left on me. One of the things that I thought was really interesting was that while these policies were being developed, the legislature, the senators and the congressmen talking about making these policies, they were looking for our advice on some things and were very, very much not interested on our input on other things. So I think that it's really important that we have people who are out there getting their hands dirty also making the policies, because there were some things, for example, the House File 2694, where you could see that this was something that the House of Representatives really, really wanted to push through. And it was something that we were like, hey, maybe this is something that we should approach with more caution, and they weren't interested at all. So I think that in the future it's going to be really important for nurses to be developing these rules and taking more leadership steps. And personally, that's something that I'm going to try and encourage not only myself to do if I can, but also my coworkers and peers around me. So I think that's my adventure in the Minnesota legislature field trip. Thanks very much for listening, and I hope you have a good day.